Hi everyone, welcome to my channel once again. I'm so happy to have you. So today is my first ever official video talking about a particular topic. Yeah, and today I want to focus on pregnancy. The reason I'm coming here to make this video is because of the recent, should I say, an unfortunate occurrence that took place at my hospital yesterday. I was actually the one on duty, and a pregnant woman came to the hospital, and then I'm sorry to say this, the delivery was quite complicated, and eventually it resulted to the loss of the baby. So that is out here to address some things that women, especially pregnant women, should always try to avoid during the course of pregnancy. It is very important because you're not just dealing with your life, you are dealing with the life of another person, which is a baby in your uterus. So I see no reason a pregnant woman would just be taking things, consuming things without even wanting to know, how does this thing affect me? How does this thing affect my baby? The truth is, we all know that pregnancy is a very delicate and important stages in a woman's life. And during this period, every action counts. From what she eats, what she drinks, and how she manages stress has a direct impact on both her health and that of the unborn baby. Unfortunately, I have discovered that a lot of women still engages in behaviors, habits, or practices that can lead to complications during pregnancy, during delivery, and even after delivery. Sometimes it might be as a result of lack of adequate knowledge about how these things affect them and how it affects their babies. So today, I will be sharing 5 key things that pregnant women should try as much as they can to avoid during pregnancy. So yes, let's get to it. The first on the list is alcohol consumption. Alcohol consumption, what does it do to your baby? First, it causes fetal alcohol syndrome, which can lead to low birth weight. It can lead to facial abnormalities, learning and behavioral problems. And what does this alcohol consumption does on you as the pregnant woman? It can lead to liver damage. It can also lead to dehydration. So why consume something like that? Why even take it? The second on the list is smoking. Smoking has a harmful effect on the baby. It has a teratogenic effect. It can cause congenital abnormality. It also causes low birth weight. And you as the mother, it can damage your liver. It can cause respiratory problems. And it can also result to cancer of the lungs. The third on the list is quite common amongst women, and that is self-medication, consumption of herbal tea and concoctions that are not prescribed by your midwife or your doctor. It can expose the baby to congenital abnormality, low birth weight. It can even lead to miscarriage. It can lead to stillbirth, that is, giving birth to a dead baby. Another one on the list is consumption of raw and undercooked meat. It can expose you to Toxoplasmosis gondii parasite, and this parasite is often found in raw or undercooked meat, especially pork meat. And this parasite, once it gets to your system, it presents with symptoms as though it is flu, with headache, muscle aches, body pains, and even swollen lymph nodes. And in severe cases, it can result to miscarriages. So as a pregnant woman, always endeavor to cook your meat properly before consumption. The last one is high consumption of caffeine. Effect of caffeine would raise your BP and can lead to hypertension in pregnancy. It can also cause dehydration. It can cause sleep disturbance, and then on the child, it can delay fetal growth. It can lead to miscarriages, and it can also lead to congenital abnormality. So my beautiful ladies, I can tell you for free that pregnancy is actually a very beautiful journey, but then it comes with a lot of responsibility. So I'm here to encourage all of you to always try as much as you can to avoid all this behavior that can result to complications during pregnancy, during delivery, and even after delivery. Note that a healthy mother equals to a healthy baby. Please always do well to attend your antenatal regularly, keep to appointments and attend them regularly. Adhere to your routine drugs. They are very important. I look forward to seeing you in my next video. Thanks for watching. I remain nurse and midwife Comfort George. Bye.